Demons, doctors, and drugs. Do you know one? Perhaps your doctor is a drug dealer. Let us consider this matter further. When I am in Asia and I visit an Eastern medicine doctor, they actually care about me and ask me about my diet, my lifestyle, my sleep, my health, exercise routine, water consumption, things that pertain to true holistic health and well-being. Unlike an American doctor where I go and wait in 3, sometimes 4 offices before finally seeing him or her, and then thereafter merely talking for 5 minutes, and they write a prescription and send me out the door and bill me more than $100 for their time. It seems to me American doctors are oftentimes no different than drug dealers. They've just legalized their practice so they don't go to jail for peddling drugs on the street. But American doctors oftentimes are pushing pills that are highly addictive, oxycodone and other painkillers that they know are highly addictive, and many people, celebrities, academics, talk show hosts like Rush Limbaugh and others have become addicted to these prescription medications, and the doctors don't even forewarn their patients that these are highly addictive substances and could cause them great harm and cause them to be drug addicts for life, because the doctor, like the drug dealer on the street, knows a paying client that continually comes back for his or her monthly prescription on an ongoing basis is a good business client, and they don't want to hinder the financial flow. But really, a good doctor doesn't merely monetize the moment. They seek the well-being of the patient and try to do no harm and truly concern themselves with their health and their well-being more than making merchandise of them and monetizing the moment. So I see, having traveled and lived both in Asia and the United States and elsewhere, such as Africa and Europe, and been to Australia and many more parts of the world, and even Canada, where I once saw a doctor, and the doctor said, "There's nothing wrong with you," and he told his receptionist to refund me the payment that I made, as I'm not a Canadian citizen, so medicine or seeing a practitioner there is not free. I think I paid $75, and the doctor kindly refunded me, which doesn't happen in the United States, because when I saw my grandmother's doctor, who our family visited for 35 years, after my grandparents were deceased, and I went there as an educator in Orange County, Florida, to merely get a tuberculosis exam signed off on that I did not have tuberculosis. The receptionist refused to allow a nurse to sign that document because she said, "You haven't been here in more than 3 to 5 years." And I said, "Yes, that's correct, because I'm healthy and I don't need your services." So I drove down to another clinic down the street, which I've never visited, and kindly spoke to the nurse, and she was more than happy to sign it for free. So unfortunately, the United States medical paradigm is an industry most undoubtedly, definitely, that's seeking to prey on patients, monetize the moment, overcharge for services. I had an ECG, sometimes they call it in America an EKG, an electrocardiogram, recently done here in the Philippines. It cost me less than $10. How much does an electrocardiogram cost in the United States? Between $1,000 to $5,000. Why? Because the American medical paradigm and industry likes to monetize the moment and prey on patients and use and abuse the insurance industry as well, because once somebody knows you have insurance, they think, well, we can overbill the insurance company because they'll pay for it. So it's a corrupt system that does not pursue the well-being and the health of the patient. So ask yourself, when you see your doctor, or maybe visit an Eastern holistic alternative medical practitioner who takes a more holistic approach to health, as I experienced when I study Ayurveda from India or acupuncture from China. And I've been to an acupuncture college in Central Florida where students who have graduated and they're doing their internship will interview me for more than a half an hour about the topics that I earlier discussed at the beginning of this video. And no American medical doctor has ever done that whatsoever. In all of the decades that I've seen them, they're more quick to push a pill and think a medical prescription will solve all health problems, because that's what they're taught in medical schools that are highly funded and financed by pharmaceutical companies to push their pills for profit. So there's an ethical an ethics violation occurring daily in American medical colleges, because even the New York Times and others have given Harvard itself, Harvard Medical School, a C grade, as there's an ethics quandary as to why medical colleges in the United States are pushing pills and not nutrition and health and herbs and natural remedies that could more easily, with less side effects, less harmful side effects, solve the same problem. So my dad once went to a doctor, and the doctor said, "Oh, you can take this prescription for your prostate." And my dad said, "Oh, can I also take saw palmetto?" And thereafter the doctor said, "Oh, yes, you can take that as well." But the doctor will first push the pill that's highly financially lucrative, because he or she gets a kickback for doing so, and not even oftentimes tell you, as they're supposed to by law, the total options available to you from a holistic standpoint beyond the pharmaceutical chemical concoction known as a prescription, because even pharmaceutical products, 25% of them come from Amazon plant life and different herbs and trees and plants in the environment that are naturally made by God, and then they extract those nutrients or minerals and create a drug and a pill to push and put a pretty color on it and sell it down at the local pharmacy. But in reality, garlic and onions and turmeric and ginger, the things that God made, are far healthier for you and more life-sustaining and vibrant with rich nutrition and energy and cancer-fighting essential ingredients that are able to sustain your body and energize and strengthen your immunity than the things that you're getting from the doctor, which sometimes can kill you. One woman went to the Orange Medical Regional Center there in Orlando to give birth a few years ago, and once she got into the hospital to give birth, she received or was able to get a virus, because a lot of the superbugs are in the hospital. She got a virus from the hospital, and sadly the doctor wanted to amputate thereafter her extremities, her legs, saying, "Oh, you have a virus and sepsis will spread to your legs." So they cut off the woman's legs while giving birth, or after having given birth, they amputated her legs. So beware of medicine that's merely trying to monetize the moment, because like I said, some of the superbugs and viruses are in the hospitals and in the clinics, and if you're not getting treated well and being taught and told how to heal your body from the inside out, how to strengthen your body with nutrition and proper lifestyle, the doctor's doing you a disservice if he or she is merely pushing pills and preying on you for profit and merely serving as a drug dealer.